listening to the new WCEG Network on WCEG Click the live stream tab or watch us live on your smart TV, YouTube, Twitter, Facebook, and LinkedIn at WCEG Network. I'm Dr. Cassandra Wanzo, your show host of Mind Matters for the next hour. We are the worldwide community empowerment group where we speak life into the community and we speak life into you. Subscribe free to our YouTube channel, WCEG Network. Like, follow, and connect with us on Facebook, Twitter, Instagram, and LinkedIn. We have new platforms. Download our free mobile apps. iOS, Apple, iPhones, iPads. Go to the Apple Store and search WCEG Talk Radio. Apple TV, search WCEG Network TV. Apple Watch, search WCEG Network. Android, mobile phones, tablets, go to Google Play Store, search WCEG Talk Radio. Last but not least, the topics and opinions are those of the show host and guest and not WCEG Network. Thank you for your continued support. Good evening again, and welcome to Mind Matters, where we discuss relevant mental health issues. Again, I'm your host, Dr. Wanzo. I'm a psychiatrist and I've been practicing in Atlanta for the past 30 years. Our co-host is Norman Carter Jr. Norm is a retired Philadelphia police corporal. He's written a book entitled The Long Blue Walk, My Journey as a Philly Cop. It's very relevant. And he recently had an article in the
Philadelphia Inquirer.
His book is available on Amazon, so please go there to purchase it. He also hosts his own show on WCEG entitled Issues and Answers on Mondays at 4 p.m. Hi, Norm.
Hello, doctor. How are you?
Good. It's good to be back. I was away in Hawaii.
Absolutely. It did you well. Absolutely.
It's Hawaii here. So our topic this evening is fentanyl, Frankenstein, and zombie drugs. Again, fentanyl, Frankenstein, and zombie drugs. I was saddened to hear about the death of the 19-month-old toddler in Florida who died from fentanyl exposure after her parents had rented an Airbnb. She was exposed to fentanyl residue left at the Airbnb that had been used as a party house. The child took a nap. About an hour later, the mother went to check on the toddler and found her unresponsive and foaming at the mouth. The mother performed CPR and called 911. The child was transported to the hospital where she was pronounced dead. The medical examiner said the child had a lethal level of fentanyl in her blood. The family was an interracial family from France, and they have since filed a lawsuit against the Airbnb and the Airbnb owners. They tested the parents, the baby formula, and they were all negative for fentanyl. Days before the family from France checked into the Airbnb, a man named Aaron Kornhauser stayed there with 11 other adults. It was a 4-bedroom house. It was in a nice section of Florida. Aaron and his friends brought in cocaine, fentanyl, and marijuana, which they consumed throughout the premises, including the bedrooms and the kitchen counter. Authorities said it would only take a couple of grains of salt-sized particles to be a lethal dose to a 19-month-old baby. Did you hear that? A couple of grains of salt-sized particles. That was a lethal dose for a 19-month-old baby. That's really scary. From 2018 to 2021, 260 children less than 4 years old died from fentanyl exposure. And recently, they have discovered fentanyl disguised as children's chewable vitamins.
Wow.
I mean, that's really scary. Fentanyl is a powerful synthetic opioid that is 50 to 100 times stronger than morphine. Nearly 108,000 Americans died between August 2021 and August 2022 from drug poisonings, with 66% of those deaths involving synthetic opioids like fentanyl, according to the CDC. Fentanyl has been found in counterfeit Adderall, Xanax, and OxyContin, and it can be made in the lab. What's even scarier now is the sharp increase of what they're calling zombie or trank dope. What zombie and trank dope is fentanyl mixed with xylazine, which is a powerful animal sedative that's used in veterinary medicine. The reason they call it the zombie drug is it causes severe skin infections, rotting of the skin, severe open wounds leading to amputation. It can also cause cardiac arrest. Drug dealers are mixing xylazine with cocaine, Adderall, methamphetamine to prolong the high and to increase their profits. And what's even more scary, Narcan does not work on xylazine because it's not an opiate. So Narcan does nothing for xylazine. That's really scary. The DEA issued a public safety alert this past Monday stating, xylazine is making the deadliest drug threat our country has ever known, i.e. fentanyl, even more deadlier. The DEA has seized xylazine and fentanyl mixtures in 48 out of 50 states. And they're saying that the Sinaloa cartel and Jalisco cartel in Mexico, using chemicals sourced from China, are primarily responsible for the vast majority of the fentanyl that's being trafficked in the US. Wow. Wow.
It's amazing. Amazing.
Wow.
And it's, most of this, one of the things you mentioned about xylazine, you said it was used on animals.
Yeah, it's used in veterinary medicine as an animal sedative, or when they're doing surgery in animals. So it's a veterinary drug, not approved for use in humans.
Well, that reminds me of back in the 60s, early 70s, they used what they called angel dust in marijuana to increase the high and lengthen the high. And that also was that ingredient. I can't think of the name of it right now, but that came from it was supposed to be for horses, and they were giving it to, and people were using that.
Wow.
So the pattern was set many years ago. But this is depressing when it gets to the point where babies are dying.
It's scary as hell. I mean, it is, pardon my language, but I know, I just couldn't believe that. I said enough, 2 grains of salt size would be enough to kill her. I
think somewhere I read that fentanyl, I have to go a little bit, check my notes exactly, but fentanyl is responsible, is the greatest killer of people from 18 to 45 something like that. It leads auto accidents, everything else. It's depressing.
Very depressing.
And I just heard on the news just before this program, they announced that there was a bipartisan delegation that just came back from Mexico, meeting with the Mexican president about, and one of the things that they discussed was fentanyl, and Mexico promised to become more strict in their border security, because this comes in from China.
Right. They use the chemicals from China and then, and then make it in Mexico, and then they bring it to the US. Right.
And China has a vested interest, and this is what happens. You in destroying American lives.
Exactly.
And weakening American morale. China has a vested interest in that. So that's the political part of this, which is dangerous. It's also dangerous, and why it's also going to be dangerous at just taking on this. I feel for people in law enforcement who are involved in trying to stem the tide of this fentanyl invasion. It's
because I'm director of a methadone clinic, and we've seen deaths like last year, like a high school student who died, and his family was just, heartbroken. A high school student. It's like we're seeing it much more. Like today, we had 2 new people to come to the clinic. Both of them were positive for fentanyl. Both of them positive. Saturday in my office, I spoke with a young lady who had, been using opiates, and she went through the program, and she's now drug-free, and she's like really doing well in her professional life. And she was in tears for the whole time we spoke, because she attended 3 funerals in the past month of friends who died from fentanyl overdoses. 3 funerals in 1 month.
Wow. I mean, it's hard to think of a business that specializes in promoting a product that kills the people that buy it. I mean, you're killing off the customer.
Scary. I've heard this from some of my patients' mouths, and if they heard about somebody, then they go try to find that dealer because they want that high too, which is crazy. They go to the dealer where someone has died to get some of that drug. I mean, that
they think they can handle it. I can handle it.
Yeah, because they want that high. They want that high. Yeah.
I guess it's like what do they used to say about crack and heroin, that the first doses really put you in that ecstasy,
and you're always searching for that first high.
You wind up chasing that high forever after that. And that's what happens. They're chasing that high, and we do it on a smaller scale with addictions to things like Coca-Cola, or cola drinks.
That Coca-Cola used to have cocaine as one of the.
Yeah, exactly.
I can't even.
That's why it got its name.
Yeah.
But people who are caffeine addicts, it's you keep chasing that feeling and not realizing that the more you indulge, the more you have to take to get that feeling or that high.
And then what happens is they are no longer getting that high, and then they have to continue using just so they don't get violently ill. So they're using to keep from getting ill, like the guy from the Murdoch trial. I mean, he was using thousands of milligrams of, I forget exactly which drug it was, but it was to keep him from getting sick. And all the behaviors that he did to try to keep up that habit, like stealing from his clients and just, unending cycle.
And I think that's why they're now adding this xylazine to it, to these drugs, because
it makes the high a greater high. But then it's so dangerous, because if you overdose, you can't use the Narcan to reverse it. Where with everything else, and even the fentanyl, you can reverse it, but with the xylazine, because it's not an opiate, the Narcan does nothing. Now that's scary, because many people have have survived from, getting the Narcan. And I've had several patients in the clinic who overdosed and someone gave them Narcan and they survived.
Yeah, this sort of reminds me of LSD, which is more popular years ago, even though it's still around. But the after effects last for years after you stop taking it. And I would assume that with these drugs, your fentanyl and your xylazine and all of these synthetic drugs, that somewhere down the road there's a price to pay.
Well, I think the price is more immediate because when you have no idea how much is in there, and people, it's killing them just, after one use. People overdosing, and then the Narcan doesn't reverse it. Like I said, my friend, 3 people in 1 month that died from fentanyl, who knows what it was mixed with, probably, xylazine, because like I said, they discovered the fentanyl xylazine mixture in 48 of 50 states. They've discovered it. We're now addicted to OxyContin, someone said, yeah.
Oh man, that's that's scary. I'm going back to fentanyl and OxyContin, I'm pretty sure it was fentanyl. Several years ago, a friend of mine was a terminal cancer patient, and one of the treatments towards the end of days was fentanyl patches.
Yes.
And I was the caregiver, but I had to be careful handling that. I had to handle that with gloves, changing the fentanyl pads, because you didn't want to get it on your hands. Yes. Because it gets right in your system. Exactly. That used to be and then you had to be careful. But I was a former medic. You know how you take your gloves off. There's people in the medical profession know how you're supposed to take off your rubber gloves. Other people don't, and you can easily contaminate yourself if you don't do it right.
Yeah. Or how about people like in law enforcement, when they're seizing or whatever, have to wear gloves, because just touching it, like you said, it can be absorbed. That's what's so scary, right? Just touching it, Yeah.
I know a police officer many years ago who she was relatively new, searching someone, and she stuck her hand in their pocket.
Oh my goodness.
And they had a needle, and all she did was prick her hand on the needle. It's within 20 minutes, we had to take her to the hospital. Wow. Because she started feeling dizzy and didn't figure out why. And then we deduced that it was from the needle that she was stuck with.
Did it determine what substance?
I don't remember. It was methamphetamine. I think it was meth.
Okay.
Yeah.
And then mixing the fentanyl and xylazine with methamphetamines, counterfeit Adderall. Like some high school student recently died. He thought he was taking Adderall, and it turned out to be like a xylazine fentanyl mix, and then he died. I mean, people just dying, from this.
Yeah, these kids are taking Adderall to increase their alertness, right. And it's terrible. And I think one of the things the CDC recommends, one of the first things that they recommend, is educating young people about the dangers of these street drugs. Have always been dangerous, but now
it's a whole new ball.
You don't know what you're getting. You really don't.
You don't know. That's what's so scary. You have no idea what you're taking. One of the things they're advocating as far as harm reduction is using fentanyl strips. There's certain strips that you can use to test to see if there's fentanyl in the drug. And so there's some, advocating for, having those more readily available so you can test it yourself to see. I mean, if somebody's not willing to stop it's not going to stop, then you do what's called harm reduction to, reduce the harm. And one way to do that, right, is to make these strips available so they can test the drugs to see if it contains fentanyl before they use it. And another thing for harm reduction is using the Narcan, but I said, if the xylazine is in there, it won't do anything. And then there's this other drug I was mentioning called the Frankenstein drug. It's made in labs in China, and it's a type of opioid. Now, the good thing about it, because it's an opioid, it can be reversed with Narcan. But the thing is, this drug is 40 times more potent than fentanyl and 500 times more potent than morphine. And this is a new emerging drug that's just coming out there, and they call it the Frankenstein drug. You got the zombie drugs, you got the Frankenstein drugs.
Wow.
Fentanyl.
This is, you know, and I think that China and Russia would be experts in this, because they would actually use things to prick people, to kill them. I mean, a little. So yeah, and again, the Chinese have a vested interest in destroying our young people, creating chaos. And it's going to be very, very difficult to stop that without educating the people.
You're right. I think education is the key, because law enforcement can only do so much. I mean, the supply is growing and growing. So, I mean, I'm not sure, you know, exactly what's being done at the borders, because it's coming in from Mexico.
Yeah, and I guess it's my own personal feeling that we blame the Mexicans and we blame the Chinese, but you know, if you're selling bad apples at the grocery store, people don't buy. And so my point is that you have a consumer market that's demanding this.
Yes,
they're demanding it.
Yes,
and it's a highway to death.
Yes.
And the news is out there. I don't think it's publicized enough. Hopefully this program will reach people that may not pay attention to other media streams. It's that this is just a highway to death. Street drugs right now.
Yes.
You don't know what you're getting.
Exactly.
And these people can't be trusted. I mean, half the dealers don't know where their supply comes from.
Exactly. They don't know what's in it. And someone taking it, you don't know what's in it either. That's just so scary, to be taking something that you don't even know what's in it.
Yeah. Yeah. And you've had some of your I know your popular entertainers now who use that freely and popularize cocaine and some of these other drugs to get high off of, but those are the very drugs that are being counterfeited and sabotaged.
Right. That's what happened to Prince. Prince died from a fentanyl overdose. He was supposedly taking Vicodin for pain, but whatever the pills were laced with fentanyl, and he died of a fentanyl overdose. The actor Michael Williams, who was in The Wire,
yes, that's
what he died. In his blood, he had fentanyl, cocaine, and heroin in his bloodstream. I don't know what he died from, but Ricky Smiley's son, he did admit that his son died from an overdose, but I haven't heard exactly what he died from. But Ricky Smiley's son, I don't know if you heard about that.
Yes.
By the comedian, his son died. He admitted that he died from an overdose, but they haven't said exactly what. I wouldn't be surprised if there was some fentanyl in the mix, because that's the latest thing that's killing people. 66% of all the drug overdoses now are fentanyl related. Like I said, and in our clinic, we just see it every day. People are coming in with fentanyl. People are dying from fentanyl.
Yeah, and you know, it's not just the dealers on the street. I know here in the town that I live in, there's a moratorium on opening what do you call them, CBD stores. And the reason is that they found that these stores are illegally, well, there's no regulations on what they sell. They say one thing, but they're selling stuff that's more powerful than what they were legally supposed to be selling. And they're doing it to people, and all the kids know about it. So the kids are using it. They're thinking they're getting the CBD oil or whatever this stuff is that they get, and they think it's a certain strength, or it's being sold, but it's much larger. It's way over the limit. So these CBD stores are now suspect. So
right, all the marijuana, even the street marijuana, has been purposely engineered to be much more potent than it used to be years ago. So even that's, even more potent. Everything is more potent than it used to be. Which
yeah,
is
yeah. And I remember it's somewhat related when there was the cocaine dump in poor areas. I definitely remember it in Philadelphia. And we couldn't figure out why all of a sudden cocaine was the rich man's drug. And now, and that's where I first encountered it. There's people in the housing projects with cocaine. And how could this happen? But there was a huge dump. It was engineered by the government. I hate to say, but that's been proven. And then you had people like Richard Pryor and others who were not only bragging about their cocaine use, but what later became known as crack cocaine. That became popular, and that killed a lot of people. And just like fentanyl, I used to wonder why, in my law enforcement career, why all the crackheads, which we used to call them, they looked like they hadn't eaten in months. And we thought it's because they put all their money into crack. But what happens is the drug dealers cut the cocaine with everything from baking soda to powdered laxatives, to that increases their profit. And that's why you see these people looking so emaciated. It's because there's so much junk in their system that's poison in the quantities that they were getting it. And you're seeing the same thing now with adding fentanyl to illegally gotten drugs. And it's killing people. And the education about it is it's just not out there. And this is it's all economic levels. It's not just poor kids.
Yes. Because our clinic is in Roswell, and our people are like, live in Roswell, Alpharetta, Swanee. These are all people that are well-to-do, and we have a clinic that's full of people. Roswell, Alpharetta, right?
Yeah, I think when it was just poor people or minorities, it was easy to ignore, easy for society to ignore, and criminalize it. But now, those people whom we used to look at as criminals are now considered victims.
Exactly. You're right. You're absolutely right. Yes.
Because the complexion has changed.
Right. Yes.
The economics have changed.
Yes.
And probably if we had been more vigilant back in the day when it was affecting supposedly affecting the minority neighborhoods, my experience in narcotics was that was basically a falsehood, because the kids from the rich neighborhoods were coming down to the poor neighborhoods to get their cocaine and their crack.
Well, in my clinic, I don't know if, since the north side is cleaned up, but I asked the young people where they went, and they used to go to the Bluff to get all their drugs. So I heard the Bluff is not there anymore.
Right. It's all like destroyed, I think.
Okay.
But yeah, same thing. I guess it's the same thing everywhere. Yeah, it's sad, but this the effects of these drugs, this fentanyl, I mean, that's death. Xylazine, that's death.
Yeah, right. And Narcan will not reverse it. So with this the Frankenstein drug that China's creating and putting out in the market here, like I said, it can be reversed, but the thing is, because it's so powerful, that they're saying one vial of Narcan is not enough. You may have to use several. That's the other thing. Like Narcan should be more readily available. I'm not sure in Georgia if you need a prescription for it at this point.
No, you can get it from is it CVS?
Okay, over
CVS,
the counter.
Over the counter.
Okay.
Yes.
That's good.
Yes, you can also get drug testing paraphernalia to test your children or whatever. Yeah, that those things are, it's more available now. In fact, it's probably easier to get that than it is to get some of the drugs that we need desperately, like drugs for diabetes and for
Right, like someone was saying,
attention.
right, because the drugs for diabetes is in short supply because people are using it for weight loss when
Right.
it's a shortage.
Adderall is in is a
Oh,
shortage.
yes, that's all my patients are having trouble getting the Adderall. And I'm still not sure what the issue is behind that. They've
Yeah,
never,
the
what,
issue is just what you said earlier, is that now I think it was overprescribing because high school children and college students have been using it for years. And it's just from what I've read is that the manufacturers were not, this started maybe in I want to say last September, October, and they were just not prepared for this sudden surge in Adderall use. So probably by, I think it's by next month, they should be up to par as far as having an adequate supply out.
Oh, there were like these two companies that sprouted up. I can't remember the names of them. Two companies that were they were just mass prescribing it online. Anyone you just set up an appointment and they'll prescribe it for you just for no reason at all. There's two companies that were like for profit that weren't run by mental health people, just for profit people, like telehealth, and you would just sign up for an appointment and they would immediately give you an Adderall prescription. And that was one reason they were flooding the market with the Adderall prescriptions.
That's we're living in a drug society. These people are, they're on our roads, they're driving cars, they're everywhere.
Yeah, I've seen several instances where parents, they end up overdosing in front of their kids. They were like in front of a car or wherever, and they've overdosed in front of their young kids, and the young kids were just left there. The parents overdosed.
Yeah, it brings to mind one of the sad stories I heard about when I was in the narcotics unit. Was a parents. They had a baby, didn't deserve it, but they had a baby, and when that baby, I'm talking about a brand new baby, if the baby cried too much, they would blow marijuana smoke in the baby's nose to relax the baby and put the baby to sleep.
What?
Yeah.
What? Yeah. Wow.
These and even now, I mean, you hear at least every month about little kids overdosing on methamphetamine or other drugs that their parents were using, that their parents just left laying around. It's easy to get high off of what, as you mentioned, just the residue for a young kid. And your parents sit there knocked out, and a kid can rub up against it, touch it, and death is permanent.
Yes.
Death is permanent.
Yes. Someone says that the CIA brought crack cocaine into the community.
Oh, that's a fact.
Yeah.
That's a fact. That's a proven fact. And that came in under the great Ronald Reagan. Yeah.
What was the purpose? What was the reason behind that?
They were making deals with this was part of the Iran-Contra mess that was going on back in the 70s. And they were making the government was making these deals. They were using, excuse me, the cocaine and even the over in the Middle East, what the heroin and the cocaine were used, the funds from that were used to finance those terrorist organizations. That's how they made their money. That's how they were able to buy their supply of weapons and whatnot and bombs. They used money from heroin, cocaine. That's what it was used for.
Wait, so the CIA introduced it to profit to make a profit.
Well, it's one of those under the table deals.
Mm.
We'll let you do this if you do this for us. It's one of those quid pro quo things that happen. But yeah, that was the United States government was behind that.
So when I said guns for drugs.
Yeah.
Mm.
And it became death for our those inner city communities. I mean, how many thousands of poor folks, young people in inner cities are dead because of that. You know,
I'm wondering, like, are they playing a role with the cartels? And I'm wondering what's happening with the cartels. What's going on with that? Yeah.
You know, one of the things I said in my book was that it's impossible for drugs to be proliferated without help from law enforcement.
Wow.
It's sad.
Wow.
It's sad, but I've seen it. And whenever you see drugs being proliferated in communities, and now you have, coming across the border, there somewhere along the line, there's law enforcement, there are judges, there are lawyers involved in this, and that's what's so insidious, and that's why it's so difficult to stem the tide. Wow. And a lot of people don't want to talk about that, but that's a fact.
Now, that's the scariest part of all. Wow.
Yeah, that's a fact.
Wow.
That's a fact.
Wow.
But fentanyl is a whole new I remember back, this would happen to be around the early 2000s, people were using legitimate, they were stealing fentanyl pads, and legitimate fentanyl was being stolen from hospitals and from doctors, from wherever they could get them, because a lot of this stuff was mailed to people, and they were stealing it and using this. But now they can make it that it was always synthetic, but now it's so easy to make that it's the profit margin is just huge, and it's in the billions of dollars. And that's why it's so that's why it's so hard to grab a hold of this. I think it says 108,000 from the CDC.
Yes.
108,000 died between 2021 and 2022.
Right. And 66% of those are fentanyl related for. So when I ask, what is fentanyl? Fentanyl is a pain medicine that people use with severe pain, like cancer or whatever. And medically, it's available in the form of patches. They have fentanyl lollipops. So it's used for pain control, pain management. Something that we have to help monitor now, it's required. They have what's called prescription drug monitoring programs. So at this point, a couple of years ago, it's required that now anytime a doctor prescribes any controlled substance, whether it's an opiate, whether it's like Adderall or benzo like Xanax, it has to be reported to this. It's called the PDMP. It's a database. And then before I see that person prescribe it, I have to check the database, and it gives me a list of all controlled substances that have been prescribed for that patient, the doctor that prescribed it, how many they got, the dosage, and when. So I have to check that before I prescribe anything like Xanax, Adderall. Well, I don't prescribe opiates, but any controlled substance, I have to check that database, because then I can see if they've gotten meds elsewhere, because some patients will do doctor shopping. They'll go to different doctors,
right,
try to get meds. But in this database, you can look and see. And I've had to terminate patients because I can see they got this one patient because he got something from me, and then another doctor a few days before, and I terminated him as a patient because of that. So it's called the PDMP.
Good thing, one of the good controls that we have. But people are getting around it. And then, you have one of the problems you have is some unscrupulous doctors.
Okay, well, yes, Dr. Feelgoods. We call them Dr. Feelgoods. There's been some of those, yeah.
I had the experience. I I had actually I had a bad reaction to some medication, and I went to this particular doctor. I known him. His doctor was in the family known him, and I had to go there on an evening, and there were, I'm going to say, 30 or 40 people in there in the evening in this doctor's office, sitting there with me. And this one young lady whom I knew, she walked over to me and said, "What are you doing here?" Because, I was, everybody, well, she knew that I was a police officer, and I told her whatever, that I had to get checked because I had hives and all this sort of stuff. And no, but what are you doing here? I said, "I'm here to see the doctor." Well, what happened is about less than a year later, this doctor was arrested. And the reason was that all of these young people who were in there, he was writing prescriptions for them for amphetamines. And he went to prison.
Wow.
He went to prison.
A few years ago, I was working at this inpatient facility, and there was this doctor there who had a really large practice. He wanted someone to come join his practice. So I went to go to his office to check out his office, meet with him. I walked in his office. This is a psychiatrist. And there are at least 20 people sitting in the waiting room. That's a red flag. How can a psychiatrist, 20 people in the waiting room at one time? 20? A psychiatrist? I can see, some other specialty, but a psychiatrist with 20 people in the waiting room? I said, that was a red flag. And I said, something's up there. Well, a year or two after that, he was arrested for dispensing opioid pain medicines as a psychiatrist, and people would just come in and he would write scripts. He was a psychiatrist and he went to jail. It was all in the news. But that was a red flag. Like you said, like some people at one time in the psychiatrist waiting room. No, if any, I have 1-2 people at the most, waiting, not 20 in the waiting room. So he offered to pay me a lot of money too, which is really,
my goodness.
I said, right there, something is off. Way, so I'm like, no, I'm so glad I didn't join his practice.
It's amazing that, all these years that they, and the expense that they have to go to college, and the years you spend in college, to hone your craft, and you never learn that you can't do stuff like this and get away with it simply because of the people that you're dealing with. Somewhere along the line, something's going to slip, and you're going to pay for it, and everything you've done in your life is wasted.
Exactly. Someone made a very good point. This is on the opposite side, that blacks can barely get prescribed controlled, substances. I remember I was having wisdom teeth, and this old doctor, white male, been in dental practice a long time. As soon as I walked in his office, the first thing he told me is, "I'm not prescribing you any opiates." I said, "Did I ask for any?" That was the first thing he said to me. And I was getting ready to have surgery. But the thing is, I really did need to have something. I had to go back to him the next week because after I was in so much pain. I said, "Look, I'm in pain and I really do need some pain medicine." I said, "I'm bringing a pain opiate, clinic. And so I know the difference, but I need something." Because then he did. But initially he wasn't, as soon as I walked in, he just told me he wasn't going to prescribe anything for me. I'm like, what?
Oh my goodness.
When he saw me, but I'm sure any other person, any persuasion coming in there, that's true. They're ready to dispense meds, to them.
Right. Yeah. That's racism in medical care.
Exactly. That's another whole show. Whole show.
Maybe next week.
Somebody said that the hospital didn't want to give them meds for a dislocated shoulder. Yeah, if you're black, you come in the first thing they think blacks can endure pain, can endure more pain, and are less likely to prescribe pain meds. I mean, there's studies showing that.
Yes, I remember reading that before. That's sad. That's sad. Another reason why we need more representation in the medical field.
Well, I mean, studies have shown that African American patients have better results when they see African American doctors, and that's, you know, a matter of, you know, a fact.
That's sad.
Mhm,
Well, it's I guess it's also similar to women receiving better treatment when they go to female doctors than going to a male doctor, and probably the
true.
reverse.
Yeah,
But
yeah.
yeah,
Mhm,
you know, you need that compassionate ear, somebody who's
mhm.
walked your path, so to speak,
Yes.
to understand. Yeah.
Mhm,
Again, that's a whole nother program. But
mhm. So when you were talking about the law enforcement complicity in this, so back when you were in law enforcement, did you have experience seeing that or at all?
yes,
Oh, you did, really?
yes,
In what way?
yes. In
Mhm.
fact, I have a book up here. It's
Uh-huh.
about a part of it deals with a uh, a police officer I
Oh.
knew him very well, and did not know
Mhm.
that he was uh, facilitating one of the largest drug rings in the city. He
Hmm.
and in fact, at one point, they couldn't prove it, but they suspect that there was a witness to a mass killing that they had in Philadelphia, and the last surviving witnesses, because there was an appeal going on, and the last surviving witness was extremely paranoid.
Hmm.
And what they did, the person was so paranoid, they never came out of their house unless it was necessary, unless they came out with the family matter. They were an elderly couple. So what they did is this guy went up in police uniform
Mhm.
and knocked on the door,
Mhm.
and the man sees the police uniform and he opens the door. And when they opened the door, these other people came in behind the officer and killed this man and his wife.
Wow.
Uh, but yeah, I knew and uh, reported uh, police officers who were actively involved in that type of behavior. Uh, I had one police officer who I didn't know factually that he was involved in it, but there was enough rumor going around. I didn't know him, but I knew of him. So I knew people who knew him, and I
Mhm.
uh, sent word. I told another police officer who knew him. I said, "You need to tell this guy that he needs to watch himself,
Mhm.
whatever he's doing, and but don't tell him where the information came from." Well, unfortunately, the guy told the guy, and this guy came to my house,
Ooh.
uh, uh, and we had a little conversation,
Ooh.
and but he continued in his enterprise. I saw him after I retired. I mean, he didn't look well, but he was one of these guys who, and they had a big investigations in Philadelphia of people who were in the narcotics unit who
Mm.
uh, were stealing drugs,
Wow.
then selling those drugs,
Oh,
using those drugs.
wow.
Uh, and there were, during my career, there were two big incidents, and sadly, uh, I knew some of the operators in that. In fact, one of the operators, while he was under investigation, he was working in the same office that I was in, and we didn't know it at the time. But they had the feds had the phones tapped, and they had somebody who was on a wire who would call him at work
Hmm.
uh, on the phone, and they would discuss what they were going to do, you know, all sorts of things that they were doing. And they would actually have these discussions on a police phone,
Selling narcotics.
selling, stealing, uh, falsifying evidence against people
Wow.
in order to keep their numbers up,
Mm.
planting drugs on people. In
Mm.
fact, in my book, I
Mm.
talk about this one officer who was in my unit. who planted drugs on um, a young lady, a single mother, and it resonated with me because at the time I was supervising this raid that we did, and she had a 10-year-old boy, and this 10-year-old boy was so traumatized. He was hysterical when we put handcuffs on his mother. I'll never, ever, ever forget that. And I had a talk with her after she was arrested because that was part of my job. And she denied. Her statement was always, I remember, that I use drugs. Any drugs I have, I use. I don't sell drugs. And then what I found out later on is because people knew the type of cop that I was, subordinates came to me and told me that this guy had planted, he stored drugs.
Wow.
And then he planted drugs on this woman. And so I took care of him. We
So
got rid of.
Was she exonerated?
Yeah, we had the charges dropped.
What
But
was it, like narcotic drugs or something?
yeah, crack.
Wow.
Crack. But the damage done to that little boy,
yes,
can't be undone.
exactly.
It can never be undone.
Exactly.
And that's sad. That what that does to the child, and what that does to that woman. I don't know whether she went into recovery or anything after that, but the trauma to that child.
Exactly.
And this was all instigated by a police officer. And again, I go back to what I said before. It is almost impossible for drugs to be proliferated in communities or in the country without some help from law enforcement.
Wow. So what can be done to address that? The complicity by law enforcement?
Well, one of the remedies that I mentioned in my book was that these acts are usually committed by police officers who have been in these specialized units for too long. You'll find that the guy that I'm talking about, he had been in narcotics for something like 15 years, much too long. There should be a limit that I suggested of 2 years maximum, because it's been proven that when these officers who stayed for 10 years in these units, you can't tell them from the people that they're locking up. I mean, by behavior, the way that they look. And there have been instances where some of these officers have actually become hooked on the drugs that they're supposed to be out arresting people for. Yeah, that's just one of the things. And I also recommended periodic psychological evaluations, and those things need to be done. But that's a leadership issue. Trust me, it's not just a simple cop on the street. It's their supervision, their leadership. That's what allows those things to happen.
So now with this guy, cop, you turned him in, or someone else did, or what happened to him, this one particular?
No, I had him removed from the unit, and immediately. And there were reasons that I didn't do it another way. If you read the story about how when I went the straight and narrow way and went through proper chain of doing things and reporting things, that I became the bad guy. And there was so much attention brought to me that the good guys the bad guys flourished. They kept doing what they were doing. So what I did was I just happened to be good friends with my supervisor, my lead supervisor, his supervisor, and we had a confidential conversation, and the transfer happened, and it got him out in about 2 days, which really hurt him because they put him back in uniform, and he retired almost immediately. That was something that he was just not equipped to do, and so we got rid of him. We just didn't get rid of him in the way that most people would have liked to have been done.
Wow. Okay. I want to give some symptoms of fentanyl overdose. If you come upon someone, a family or neighbor, and so some of the symptoms of fentanyl overdose are difficulty breathing or shallow breathing, extreme drowsiness, unresponsiveness, cold, clammy skin, pinpoint pupils, slow or weak pulse, low blood pressure, muscle weakness, or coma. So if you suspect that someone is experiencing a fentanyl overdose, please call 911 immediately and seek emergency attention. And it behooves everybody, schools, home, to carry naloxone, which is Narcan, which you can purchase over the counter. And people, it literally reverses the overdose. You spray it into the nostrils, and literally in a matter of seconds, people will come to and will reverse the overdose. So it's important to know that fentanyl overdose can be fatal, and timely medical intervention is crucial to the best recovery.
And I think it's also important to note that you will not be arrested, nor will that person be arrested, if you're involved in saving their life and you call for first responders. You're not going to be arrested. That's not their concern. Their concern at that very moment is for the life of that person who's there. So neither the police nor EMT, emergency medical people, are concerned with arresting anybody. It's all about life saving.
That businessman from Georgia who was found dead in Louisiana.
New Orleans? Yeah.
Yes, what they found out is that he had gone with some guy in a car to some house, overdosed with these group of people, and then they wrapped his body in a carpet.
That's carpet.
Yeah, after he had overdosed.
Oh boy, oh boy, oh boy.
Yeah.
And this was a guy who
a businessman,
was seemingly well-to-do.
Yes, a businessman. Yeah.
Yeah.
So that's the important thing, though. It can affect anybody, all stratas of life. I mean, look at like Murdaugh. I mean, he was like a very well-entrenched, attorney, so anybody. It can happen to anybody. Opiate addiction. It can happen to anyone. Physicians, lawyers, anybody. So.
And just a reminder before we get out of here is that according to the United States Center for Disease Control and Prevention, fentanyl is now the top cause of death among United States adults between the ages of 18 to 45. More than COVID-19, more than suicide and car accidents. The CDC reports that of 100,000 adults who died from drug overdoses from 2018 to 2020, a staggering 19,400 or 19% had died from overdosing on fentanyl.
Wow.
And I'm sure these people had no idea, a lot of them, what they were taking.
Exactly. Just be careful. You don't know what's out there. I mean, so educate your children, and we need to do, better jobs as a society to educate people. Of course, you're going to have those people who, won't listen, but it's still our job to educate people about it, because like with the fentanyl, it can be on your clothing, drug paraphernalia, and children touch that, then they can die. Like that little girl, 2 grains of salt size was enough to kill her. So it's really scary. So it makes me scared of using it. Well, I've only been with the Airbnb one situation with somebody, but you don't know, what they use in terms of, say, cleaning. So they're holding the Airbnb responsible because of lack of proper cleaning, procedures. So
yeah, but somebody's dead.
Yes, a 19-month-old.
You can't put money. I mean, you sue and you get some money, but a life is gone.
Yes.
And,
yes.
You can't put money on that, and that's just sad.
Yes.
That's sad.
thanks for tuning in, and have a very blessed and productive week. And we'll see you back next month in with 2 or 3 weeks for the next show. All right. Thanks. Good night.
Thank you. Good night.